Before she died by suicide on April 2nd, Taylor Alessania, a 16-year-old student at Fallbrook High School, said she continued to be bullied about her transgender identity after she told school staff. Another North County transgender teen named Sage killed himself in March. Joining me with insight into the struggles of transgender teens and ways to help are my guests Kurt Cunningham, Outreach Coordinator for Mental Health America's San Diego County Chapter, and Vanjie Akridge, an educational psychologist who works with LGBTQ teens. Vanjie, Taylor talked about sitting alone every day at lunch, wearing earphones, walking between classes so she wouldn't hear this bullying or name calling. How do schools deal with, or how should they deal with, a biased bullying?
It's important for schools to create a climate and a culture that is accepting and has unconditional positive regard for all students. So it is directed at the lead of the administrators to make sure that that climate is emotionally safe for all.
And Kurt, is there anything that schools have in place now to deal with this?
Well, schools in San Diego County have the Safe Schools Act. Unfortunately, it's not quite reaching its goal yet. It's been in place for about 4 years, and people are working at getting this implemented, but it's not quite reaching its goal.
So there's something in place, but clearly it's not all the way developed yet, or at least working yet. Vanjie, what specific challenges do transgender teens face?
Well, I think the anxiety and depression that comes from them looking in the mirror and not being comfortable with the person that they see in the mirror and having a very different image of themselves and not being clear if and when that image in their mind will, match what they see in the mirror.
Mm-hmm. Kurt, your outreach, I understand, included an instructional lecture called LGBTQ 101. What did you discuss in that, and who attended that discussion?
That discussion was created for the psychiatric hospital, doctors, social workers, nurses, myself, and one of my advisory committee members, Liat Wexler, created this presentation and co-facilitated the presentation at the hospital. The hospital approached me because they needed more information, sensitivity training, because they were seeing an increase in transgender patients. So I've developed this training along with Liat to present at schools, other mental health facilities, medical facilities, anywhere that needs it. We can tailor it to their needs as well.
And Vanjie, how do you properly address somebody who is transgender, and why is it important to identify the person appropriately?
I think it's important to have a conversation with the person who identifies as transgender, what their preference is, because the last thing you want to do is dismiss who they are as an individual by not adhering to their preferred name and pronoun.
How are other LGBT and Q teens that you work with, how are they coping with these two deaths in their neighborhoods here?
Well, I think the LGBTQ community at large throughout our county is struggling significantly. Any loss of life, I think, is a challenge and is something that we all struggle with, both those directly identifying with the LGBT community and those professionals like myself who support the community.
And Kurt, what is out there for, specifically, let's talk teens in schools?
Teens in schools, we have the Trevor Project. They have a lifeline, they have text, Trevor Chat. There are resources for teens, for adults, transgender teens. Transgender adults have the translifeline.org. It's a website, and there's a crisis line there that they can reach. It's a transgender driven, transgender staffed, so these people can relate to the issues that they're calling about.
And Vanjie, how would you like to see people, parents, friends, help support somebody who is transgender?
I think it's important for, folks to ask the right questions and to inquire about how that individual is feeling. What we don't know can definitely be detrimental to that person's life and overall existence. So it's important to be informed.
And Kurt, what would you say here if somebody who is a transgender teen says, listen, I'm struggling, I need some help? What's the first step?
The first step is to get them the help. Sometimes people dismiss it as a cry for attention, but if someone's crying for attention, what's wrong with giving them the attention they need?
So where do you take them? Where do they go?
If they're in school, they seek out a counselor, principal, teacher. If they're at home, you find the resource like the transgender, translifeline.org or 911 in some cases.
All right. We are out of time, unfortunately. Vanjie Akridge and Kurt Cunningham, thank you so much.
Thank you.
Thanks.